Hello, this is Dr. Alan Menter. I'm the chairman of the Department of Dermatology at Baylor University Medical Center in Dallas. I will be discussing retreatment with Brodalumab, results in high response rates in patients with psoriasis after treatment interruption. This poster was presented by Dr. Armstrong and her colleagues at the 76th annual meeting of the American Academy of Dermatology on February 16th to the 20th, 2018 in San Diego, California. A summary of the study. The trial involved patients with moderate to severe psoriasis who achieved a good initial response with Brodalumab. Following treatment withdrawal and subsequent reinitiation of Brodalumab, the vast majority of patients returned to their previous level of response within 16 weeks. The importance of the study is, I believe, these results are very relevant to real-life practice, because it is not uncommon for patients to stop and restart their medications for multiple different reasons. I'd now like to describe the study. First of all, the methodology. Patients with moderate to severe psoriasis were randomized to Brodalumab, either 140 milligrams or 210 milligrams, or placebo every 2 weeks during a 12-week induction phase. At week 12, patients receiving Brodalumab who achieved a static physician's global assessment, the SPGA score of 0-1, were re-randomized to their induction dose of Brodalumab or placebo. Beginning at week 16, all re-randomized patients who experienced return of the disease, which was ranked on an SPGA of 3 or greater than 3, qualified for retreatment. In these patients, Brodalumab was reinitiated at the induction dose of 140 milligrams or 210 milligrams every 2 weeks. So now let's talk about the key findings in this interesting study. 79 of 84 patients, which is 94%, randomized to Brodalumab 210 milligrams every 2 weeks in the induction phase and re-randomized to placebo in the withdrawal phase, experienced a return of disease. The mean and median time to return of disease was 74.7 days and 56.0 days, respectively. Most patients with psoriasis who experienced a return of disease following Brodalumab withdrawal returned to their previous level of response 16 weeks following reinitiation of Brodalumab. Of the patients who exhibited a PASI score, Psoriasis Area and Severity Index score, of 75 prior to Brodalumab withdrawal at week 12, 92.1% achieved a PASI 75 by week 16 following reinitiation. Of the patients who exhibited PASI 90 prior to Brodalumab withdrawal, 91.2% reached a PASI 90 by week 16 following reinitiation. And finally, of the patients who exhibited a PASI 100 prior to Brodalumab withdrawal, 90.5% reached the same PASI 100 score by week 16 following reinitiation. I'd like to give just a short commentary on what I believe is important in this study. From a protocol consideration, patients who either personally discontinued their biologic drug, who lost appropriate insurance reimbursement, which happens to all of us all the time in clinical practice, the vast majority, which is 90%, will regain the initial excellent response. And that's important because we have other studies and other drugs over the years where patients do not respond as well after reinitiating therapy. And here we have 90% who do. What about the results of the study? How does it impact the future management of patients, the future state of patient management in the field of psoriasis? If we were able to determine remissions with our psoriasis therapy, which we currently cannot, it may be possible for us as dermatologists to temper patients' therapy, in other words, even discontinue therapy for a period of time. We don't yet have biomarkers that can predict what we call a remission or predict a reoccurrence of psoriasis. And yet all patients ask all of us, "Doctor, I'm clear, why do I need to continue my treatment?" And I do tell them, because we cannot predict when you're going to flare. And here we have a drug that in 90% plus of patients in this study showed that they regained their clinical response in a very, very positive manner after discontinuing the therapy. And so many times patients lose their insurance will go away on vacation, forget to take their drug with them, and they have to restart it at a later stage. So this is important data for Brodalumab.